Hey guys, so this is the last lecture for Veritas et Misericordia 3. So this topic is all about empathy. So empathy and the practice thereof. Anyways, let's define empathy first. Empathy is the action of understanding, being aware of, and being sensitive to and vicariously experiencing the feelings, thoughts, and experience of another, or either the past or present, without having the feelings, thoughts, and experience fully communicated in an objectively explicit manner. Anyways, when you say empathy, this is just in short putting yourself in the shoes of others before you say that you understand them. So this is basically an imaginative projection of a subjective state into an object so that the object appears to be infused with it. So basically you are imagining yourself as the other person and feeling what the other person is feeling. Now, sympathy and empathy are closely related words because they, in fact, came from synonymous roots, or rather, they come from almost the same roots. For one thing, sympathy is considerably older than empathy, meaning that it was conceptualized far before empathy was. But sympathy is a bit less than your empathy. So when you say sympathy, you have this feeling of loyalty, unity, and harmony in action or effect. So just basically looking at the other from your own perspective, meaning that you impose your own will, you impose your own ideals into what they're feeling. So basically, this is interpreting what is happening to the other person. So things that you could feel is like pity or yung awa, uh, and some form of understanding that is not in level with empathy. Now, when you say empathy, this is rather putting yourself in the shoes of another person. So, for example, if you are a person born with a silver spoon, meaning that you are born to rich parents or middle class parents, and then you see people who are in the lower class. So this is then putting yourself in the shoes of the lower class person, as instead of looking at their situation from the point of view of a person born with with a silver spoon. So this is like a celebrity uh, looking at the issue of homelessness and saying, why not just buy a house? Okay, so they are looking at the other people from their own perspective. Whereas empathy is a bit different because you look at the situation of another person from their own perspective. So you're imagining yourself as being them. So that is empathy. So empathy is the experience of understanding another person's thoughts, feelings, and condition from his or her own point of view. Now, this is very important because this is what separates empathy from sympathy. Okay, so you don't have to be forced to feel empathy. You don't have to be obligated to feel empathy. So empathy happens to you, or empathy is developed when you act on your compassion to other people. Now, it's also the ability to relate to another person's pain vicariously, as if one has experienced that pain themselves. So, as opposed to being just sympathetic, when you say sympathetic, you know what they're going through, you know their feelings. But when you say you are empathetic, you are actually imagining the pain happening to you when you are in their situation. For instance, people who are highly egoistic and presumably lacking in empathy keep their own welfare paramount in making moral decisions like how or whether to help the poor. Okay, so like I mentioned earlier, the people in rather the people who lack in empathy see helping as a form of pity instead of as another form of being compassionate. Right? So you have three different types of empathy. You have cognitive empathy, which you understand what a person might be thinking. This makes us better communicators because it helps us relay information in the way that best reaches the other person. So this is actually very common in high school, middle school, or lower intermediate teachers, because they have to be able to relay information, or relay or make other people understand at their relative level of understanding. So if you're teaching someone in grade 5, then you should be able to relay information that a grade 5 student would understand. Next, you also have emotional empathy, so also known as affective empathy, is the ability to share the feelings of another person. So some have described it as your pain in my heart. So basically just feeling the pain of another person in your own heart. Okay? Lastly is compassionate empathy. This goes beyond simply understanding others and sharing their feelings. It actually moves us to take action, to help however we can. Now, that is particularly apparent now because most people, or a lot of people, are starting to help others that are affected by calamities under their own volition. So, without being forced or obligated, they are stepping out of their houses and helping other people so that they could extend what you call compassionate empathy. Now, these three branches do not actually work separately. This is a step-by-step process that works together. So this is a sequence. So you have your cognitive empathy, you have your emotional empathy, and then finally, from those cognitive and emotional empathy, you get the compassionate empathy. So this is then illustrated by if a person loses a family member, your natural reaction may be sympathy. So like I mentioned earlier, sympathy is mainly pity, sorrow. Okay? This means that you can express condolences, and your friend may appreciate these actions, but showing empathy takes more time and effort. So it begins with cognitive empathy, imagining that what the person is going through, and then you have your emotional empathy. Once you understand who the person lost, then you can feel the pain, or you can imagine yourself losing the same person or the same significant person in your life. And then finally, you have your compassionate empathy, which moves you to take action. So you're trying to go and console the other person. You're trying to go and help them move along um, with their feelings. Okay, so this is just one example of how empathy works. But every day will bring you opportunities to develop this trait. In fact, every interaction you share with another person is a chance to see things from a different perspective, to share their feelings, and to help. So you have those kinds of considerations when you get to empathy. Next is empathic listening. So empathic listening is basically just a way of listening and responding to another person that improves mutual understanding and trust. So it is essential skill for third parties and disputants alike. So basically, when you say empathic listening, this is basically just listening with all your attention and all your heart, as opposed to listening just because you want, or you are respecting what the other person is saying. So empathic listening is hearing the words and understanding what they mean for the other person. So, again, this is very important with conflict. So, it could be conflict between larger bodies, like uh, two, two participants in a debate. It could be uh, resolved during mediation, or it could be conflicts that are not resolved during mediation. No? So the listening process can have a profound impact on the parties, meaning that whenever you have to practice empathic listening, you have to really listen as opposed to just simply hearing the words they're saying. So, like I mentioned before, whenever it's a lot of times actually that people just don't listen to what you say. So if you can observe this when you're conversing with other people, some people actually just wait for you to stop to finish talking so that they can share their part. So those people are not empathic listeners. Empathic listeners listen to what you have to say and then reflect on what you have said. unlike other people who just wait for you to stop talking so that they can share their own ideas. So, again, those are not empathic listeners. Now, empathy is the ability to project oneself into the personality of another person in order to better understand the person's emotions or feelings. So, like I mentioned earlier, empathy is very imaginative. So, you're trying to imagine yourself in the shoes of the other person. So, basically, you have to listen as if you're watching yourself talk. You have to try and understand what the other person is saying without judging them. Because that's how you would like to be listened to. You don't want the other person to judge you, you just want them to listen and understand how you're feeling. So, extend the same compassion and empathy with other people instead of just waiting for them to finish talking. Actually listen to what they have to say and actually reflect on what they're saying. Because who knows, this might help you resolve something in the future, or this might help you gain a lifetime friend. So make sure that whenever you listen, you practice empathic listening. Okay? So once again, even though the previously cited article focuses on mediation, empathic listening is a core skill, not only in our profession, but also in many other professions, and especially in those professions that require us uh, to communicate with patients on a certain level. So for example, whenever a patient is, or whenever a person is talking to you, make sure that you actually listen to what they're saying. In fact, there are some instances that these tiny details have saved lives in the hospital. Okay? So there are times when the doctor actually listened, he remembers a detail that could be important to the treatment of the patient, when in fact other doctors would have missed it because they are not empathic listeners, or they're just waiting for the rambling of the patient to finish, and then they just want to leave, or leave the patient alone. So in our profession, especially in the profession of healthcare related professionals, we have to make sure that we actually listen to our patients. We have to make sure that every little detail of the patient, of what the patient is feeling, is reflected upon by the healthcare professional. Okay? The power of empathic listening in volatile settings is reflected in Madeline Burley Allen's description of the skilled listener. When you listen well, you acknowledge the speaker, increase the speaker's self esteem and confidence, tell the speaker you are important and you are not judging them. So make sure that you listen. Actually, you make the speaker confident about what they're saying. You make sure and they assure them that what they're saying is for you to understand, and that you are not judging them in any way. So, anyways, that is in fact the last lecture for our Veritas 3. So, make sure that in the future, whenever you are actually dealing with patients, you practice empathic listening. So, not only should you listen or wait for them to finish speaking, but actually listen to what they have to say. Okay, sometimes this is very important in phlebotomy. Some patients tell you that not to extract at a certain part of their body because that's where they're most sensitive. So make sure that you listen. Okay, and if you listen, you'll find more details in what that person or what the other person is trying to tell you. Okay, so that's about it for this final lecture. So good luck with your major subjects, and just wait for the final exam or the final activity we're going to have for Veritas 3. So goodbye and stay safe.